I'm Dr. Irfan Malik. I'm the senior partner here at Elmswood Surgery in Nottingham. And over the last 2 months, I've noticed an increase in presentation of cancers, and some of them late presentation. So at the moment in Nottinghamshire, there is a very low rate of COVID and higher rates of cancer presentation. So yes, COVID is less of an issue at the moment. Whereas the backlog of other medical conditions and cancer is more coming to the front. I know locally that cancer referrals, which we call 2-week wait urgent referrals, in some specialties have reduced by up to 30% in the last year. So there are less referrals coming from primary care into the hospital urgent clinics. And I think part of that can be explained is that we've seen less patients face to face and we've detected less worrying symptoms that we've referred on. But after the recent press coverage, I did get support from patient groups who are involved in cancer and also some oncologists as well, who at the hospital end are have seen less referrals in the last year, but now are seeing more severe late stage cancer presentation, which has a damaging effect for the patient in terms of life expectancy. So from the beginning of the pandemic, we had to change to a total triage system, which meant that patients couldn't book in directly for face-to-face appointments. They had to ring up, book a phone appointment with a doctor or a nurse, and then we would book in patients for face-to-face if required. Otherwise, we would manage patients on the phone. So we switched to that at the beginning of the pandemic last year. But at the same time, we kept our front doors open. So there was no locks, no intercoms, because I wanted to make sure that we were accessible to our patient group. It was difficult to change because we had to, totally change our approach, because pre-pandemic, I would see 16 to 18 patients in the morning face-to-face, and in the evening about 14 patients. So over a few days, that changed to entirely phone calls with a smattering of patients in for face-to-face. So it was different, and we had to get used to managing conditions on the phone, which could involve more risk as well, because you haven't got the patient in front of you, you can't examine the patient or observe. So it was a different type of consultation model, but we've always done phone calls, phone consultations in general practice. So we are used to giving advice on the phone, but it just went totally the other way at the beginning of the pandemic. I personally feel you have to be quite intelligent and articulate to have a phone call consultation with a doctor. So there are groups, for example, mental health, learning difficulties, language problems, the elderly and frail, who really struggle with, number one, booking the phone appointment, and then having a constructive discussion, consultation on the phone. So these groups potentially could have been disadvantaged by this change of model. I'm a great fan of face-to-face consultations because I've known my patients for over 20 years. As soon as somebody walks through the door, I can observe them. I can tell if they've become anemic or whether they've lost weight or whether they're not quite right. You can't do that on the phone. I can turn and show you, a headline in this Daily Telegraph newspaper. GPs told to screen patients online first. Face-to-face appointments should be discouraged, says NHS guidance. It looks like there are pressures to maintain a system of total triage. Now, I don't have any agenda in this, and I see the way forward is that there will be some triage, but also essential to keep face-to-face appointments there as well. And some of them may be possibly directly booked by the public as pre-pandemic, which patients were used to, so that we don't screen all face-to-face appointments. We just leave it up to the patient and the receptionist to decide, who to slot into a face-to-face appointment. So something is happening now that wants us to keep that triage in our day-to-day working, and I think that's what now has become critical, and that's why we're getting a lot of negative GP stories in the mainstream media. About poor access, difficult access. The phone access is there, but the face-to-face access is less than it used to be. And I think now the public realise that this may stay a little bit longer, and primary care teams, are getting directives like this that we should stay with triage. So, even when the pandemic is very low now, so it looks like some things are here to stay. So over the last year, with the pandemic, with the change to total triage, we have lost that connection with families because we look after generations of the same family, and that is I look at that with sadness because that's the part I enjoy, the connecting with people and the seeing people face to face. And for me personally, doing a majority of phone calls this year has been difficult, and I found it hard, and I can't imagine that I would carry on doing that for years to come. It doesn't give me the satisfaction. The reason why I came into this job is to help people and to meet people. You have to be a people person to survive in general practice for 30 years. So it's had a knock-on effect on practitioners, doctors, nurses as well, because there's less enjoyment coming from helping patients. We've spoken about the backlog in cancer diagnosis, but it goes across the board. All medical conditions will be affected, and the huge mental health backlog as well. And it's going to take years to sort this out on the primary care interface. But also we have the hospital interface as well. So appointments are going to be delayed for outpatients care. Operations are going to be delayed. So we are caught in the middle as GPs because we're having to chase up outpatients appointments for patients that we wish to prioritize, but we are sometimes up against a brick wall of a 1-year wait to see a consultant and then an extra wait for surgery. So we can't really influence that or change that. So it's a double whammy for the patients, really. Number one, they may have presented late by holding on to symptoms, and then when they do get referred, they're going to be seen a lot later than they would have been pre-pandemic.